Here is a quick quiz. Don't worry, you will not need to turn this in. These are assumptions you may have heard. Can you tell the myths from the facts? Assumption number 1, true or false? People with developmental disabilities may or may not be intellectually disabled. This is true. While many developmental disabilities do include cognitive symptoms, many others do not. For example, physical disabilities like blindness. It is important to understand that intelligence is not linear. Just because a person struggles in one area doesn't mean they will have difficulty in others. And it doesn't matter anyways, because people with intellectual disabilities should be afforded the same dignity and respect as anyone else. Assumption number 2, true or false? Adults with developmental disabilities should not or cannot live independently. False. Humans want to control their own lives and make their own choices. Those with developmental disabilities are no different. For some, total or near total independence is possible. For others, assistance in distinct areas of their lives might be appropriate. Even for individuals with profound developmental disabilities, maximum independence is desirable. The goal when caring for someone with a developmental disability is to teach them the tools and resources they need to live as independently as they can. Assumption number 3, true or false? Individuals with developmental disabilities have behaviors that cannot be understood. False. It may be difficult to understand some behaviors, but all behavior is communication. And usually it is communicating a need. Professionals are often able to identify the source of challenging behaviors, which is why therapists and social workers are so critical to the foster care profession. However, professionals aren't always needed to understand the source of the behavior. For example, if an individual who happens to be nonverbal begins to act out aggressively, we could reasonably assume they are feeling threatened and can respond in a way that makes them feel safe. It can take time to learn and understand behavioral messages, but in the long run, it is possible to change a child's negative behavioral responses to more positive and productive ways of responding. Assumption number 4, true or false? Those with developmental disabilities can be trained for a successful career. True. Sadly, the assumption that those with developmental disabilities cannot be employed has caused unnecessarily high levels of unemployment among individuals with developmental disabilities. They may need some extra training or supervision, or they may have some physical or cognitive limits, but that does not mean they cannot work at all. Just like any person, individuals with developmental disabilities can achieve fantastic results from learning new skills and abilities, especially when training is designed to prepare them for the workforce. Educational and vocational training can prepare individuals for a wide variety of jobs and careers. Beyond job-specific tasks, vocational training can help individuals learn job interview techniques, understand appropriate dress and work behavior, and learn new skills for working with colleagues and communicating with managers. Assumption 5, true or false? Developmental disability is synonymous with mental illness. False. Just like developmental disabilities and intellectual disabilities are not necessarily coexisting, the same is true with mental illness. Unfortunately, many with a developmental disability do experience mental stress at a higher rate than their non-disabled peers, which can lead to depression and anxiety. But that is not the same as mental illness. Mental illness affects mood, emotions, and behavior, and is extreme and persistent. Examples include schizophrenia, bipolar, and major depression. It is possible and not uncommon for a person with a developmental disability to suffer with a mental illness as well, but in these cases, it is considered a secondary condition. Assumption 6. True or false? People with disabilities benefit from being with non-disabled peers. True. Science has proven that those with developmental disabilities learn better when they are included with their non-disabled peers, and their non-disabled peers learn better too. Inclusion is always the best.